Healthy Living Alliance Heala says it's publishing a report that shows how big companies are able to influence public discussions around what we should be eating and how they're able to influence policy. In other words, to put it another way, they seem to be suggesting some companies are actually able to have a big impact on what government policy actually is. So, for example, imagine the public discussion around whether there should be a sugar tax. You can imagine how important that is to certain companies. Well, let's speak to the Program Manager at HEALA, Lawrence Mbalati. Lawrence, good afternoon to you. What exactly are you claiming here? What are these companies doing?
Good afternoon, Stephen, and good afternoon to Newsroom Africa viewers. So the objective of the study basically we're looking at to identify the corporate political activity of the food and beverage industry in South Africa. We were basically looking at information that is not classified, basically from websites, social media, health journals, newspaper clips. So information that is publicly available in terms of what are some of the interference and political activities that the industry would undertake to actually influence unduly the process of health policy in South Africa. So Stephen, you'll notice as much as we have the State Capture Commission, the prima facie evidence came through politicians, powerful politicians, taking certain decisions and ensuring that politicians are getting things or are being provided with and government departments as a way of influencing certain decisions towards them. So this, for us, is a serious matter because we feel like South Africa has actually been lenient also on the sugary drinks tax, to cap the consumption of excess sugar in South Africa due to the industry putting together, the arguments that were actually not factual, to make sure that parliamentarians and decision makers can make decisions that actually are not based on fact on the ground.
Okay, so to put it another way, for years and years and years, tobacco companies used to say that smoking isn't bad for you. In fact, they used to sometimes quote doctors saying it was good for you. I'm talking about the 1950s. We know what happens, of course, with smoking. Are you suggesting the sugar industry is that bad? It would be quite a strong suggestion if you were.
Precisely. So if you look at it, the example that you gave of tobacco, right, that, tobacco could help to cure certain things, and then they will get researchers to arrive at certain things, minimal things that maybe tobacco will be able to do in your body. So the sugary drinks industry is using similar tactics in the way that they would fund, for example, if you placing, a healthy activity, a health activity or a nutrition activity in a school or for health, they will come and fund and give the sugary drinks. But today now we know that, excessive sugar, excessive fat and salt causes obesity and excessive and communicable diseases. So the similar tactics that they will use, because government has got gaps when it comes to social spending, they'll bring the social corporate investment as a way of filling the gap, and bringing a good public perception about their brand. Over and above that, they have a table, in terms of policy making from NETLEC, in terms of, what are some of the policy impacts on the economy. They have a policy, a seat on the policy discussion, but over and above that, they've gone above and giving scholarships and things that are of a good cause, when it comes to mitigating some of the socio-economic issues in South Africa.
I mean, in the end, it really boils down to what actually happens. And I mean, there's also a ton of advertising. I mean, you'll see advertising for Coke and Pepsi everywhere in all sorts of different ways, some of it quite coded.
Precisely. So one of the arguments that the industry has used was that they can self-regulate. So one of the pledges that Coke had made, I think in September 2016, was that they will stop advertising sugary drinks like Coke as a brand to underage children. But for example, I can give you a practical example. If you go to MTN 702 Walk the Talk, right, it's family fun, people are walking, it's activity, for healthy living. You'll find Coke spilling all over, free Coke spilling over, set up in every, street where people will just come and have Coke. So those are some of the things that we are saying they must be strictly monitored and we require transparency, right? And we look at it in a more serious manner in terms of it could even lead into the conflict of interest in future. But what this study has found is that, there is a greater need for, mapping out the industry activities, because we have found enough evidence, prima facie evidence, of political interference, because these are the departments that they have actually targeted: trade and industry, the Department of Health, Sports and Recreation, Basic Education, Agriculture. If you look at these departments, they are actually, in one way or the other, involved in the trade, in terms of production of food, in terms of regulating the food industry. So in a way, there is a direct link, in terms of the interference and influencing how South Africa must actually enact policies that save lives.
I mean, I would imagine that those government officials would strongly deny that they're influenced by this industry. They would say just the fact that we have a sugar tax at all is progress. I mean, 10 years ago, people would have laughed at a sugar tax.
Correct. And I think I must put it categorically that the study didn't find, a conflict of interest in terms of politicians. But what we are putting forward is that we feel we have enough evidence, right, of influencing policy. Because one, if you look at the sugary drinks tax, the benchmark internationally in terms of the effective consumption, right, we have seen with tobacco, right? Tobacco was also complaining about job losses and putting figures that were beyond imagination, that if you put taxes on tobacco, there will be there will be bloodbath of jobs. So, but today, anyone who smokes must pay more, for health promotion, for investing into other social expenditure, if someone were to do, because today we know that tobacco is harmful. So the same way that we know there's an increase of diet-related non-communicable disease, obesity, diabetes, and blood pressure, and some form of cancer, the same way the food and beverage industry is expecting to be treated with kid gloves. So the benchmark for the sugary drink tax was 20%, and it ended up being watered down to 11% because the industry came with arguments which were inaccurate, and they were using other methods, and other tactics to unduly influence the policy at government level and the decision makers level.
Lawrence, I do have to ask, I mean, when we look at how all of this is changing now, at the moment, as I understand it, both in the Western Cape and in Gauteng, if we look at the number of people who've been severely affected by COVID-19, both hypertension and diabetes are big factors. I mean, that underlines the importance of what you're saying, if what you're saying is true.
So if you look at the non-communicable diseases, combined, they are the leading cause of death. If you look at diabetes, it's the second leading cause of death in South Africa. 60% of people, pre-diabetic or living with diabetic are undiagnosed. So the time bomb of non-communicable disease and how the COVID-19 has amplified, the silence that has been there in the non-communicable diseases. Steve, if you go to a clinic today and you are told you have got high, you'll be told reduce salt, reduce sugar, in your food intake, reduce fat. But the science and the politics are still hidden. And the food industry is actually playing a leading role. And if you look at the struggle of HIV or fighting HIV, we unearth, the drug companies' greed. So the same way, I think what we're trying to do is to show the bev and the food industry of what it is. They will deny it, but today we know that unhealthy food, right, that they are promoting every day. If you knock off, it's convenient to drive through, to do a drive-through and get unhealthy food instead of preparing a meal because of time. So the way in which this rigorous marketing is happening and the way in which there is a silence around, the time bomb of the non-communicable diseases in South Africa, it's very worrying. And I think the food and beverage industry has kept the government, to say least, to act to list in terms of policy, and South Africa needs a very strong policy. And you have seen, we have had talk where the sugar industry came through, and they spoke about how they are losing jobs and how they want to be treated with the kids' gloves. But the issue is now, why is tobacco, every year having an incremental tax, that is being provided based on inflation and other calculations? The sugar drinks tax again, has been held at 11% without any increase. But we know that the unhealthy food, the unhealthy beverage are significantly contributing to the non-communicable diseases.
Lawrence, if you go to some other countries, you'll see that younger people are much healthier than their parents. So they exercise more, they don't drink as much, they don't smoke as much, they eat better. I mean, frankly, Lawrence, they're boringly healthy, if I can put it like that. I'm not being entirely serious. We're not seeing that happening here, though, are we?
We're not seeing that happening here. And I think because, you know, regulation of the food and the beverage industry, or the food policy regulation, it's not the only solution, right? We need to bring a lot of awareness. They're just the same way as the struggle of HIV, where we brought a lot of awareness, we brought a lot of campaigns, not a once-off campaign, you know, that, you know, sensitize people about the risk of the body inactivity, the risk of eating unhealthy food, how diet is important in someone's health, you know, the dangers of smoking, the overconsumption of alcohol, the harm of alcohol, you know. But again, in South Africa, you see celebrities, you find how the industry invests a lot, you know, in making our lifestyle, you know, look like they need to fit into consumption of those unhealthy products. So I think there is a greater need from civil society, from government, you know, to actually make sure that the agenda, you know, the political and the science and the education and the awareness of the non-communicable disease, you know, and the risk associated with what are some of the risks, because these are preventable diseases, these are lifestyle diseases, and it's worrying that actually South Africa is going up and up every day.
Lawrence Mbalati, do appreciate the time. Thank you, Program Manager at the Healthy Living Alliance. Strong views there. I do wonder if there'll be a response from some of the companies that are involved in that industry.